Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. We're going to be joined this morning by singer-songwriter Crystal Bowersox. She's living with diabetes, and Dr. Gregory Dodell. They're joining us here to talk about a new initiative, Know Before the Low. It's an initiative to help those living with diabetes like Crystal to be prepared for low blood sugar, and that preparation includes having a rescue plan in place for very low blood sugar emergencies. Welcome to the program, both Crystal Bowersox and Dr. Gregory Dodell. Thanks for joining us.
Thank you.
Right. Well, Crystal, a bit of your background, if you would. Tell our listeners a little bit about yourself. I mentioned you're a singer-songwriter. Tell us a little bit about yourself, and then I'll ask Dr. Dodell to give us a little bit of his background.
Sure. Well, I guess most people may remember me from American Idol. I was a contestant back in 2010 on season 9, and it became public that I had been living with type 1 diabetes. I was diagnosed when I was 6 years old, and so I'm coming up on 30 years of living with type 1 diabetes. And it can be a struggle, you know. It's a daily balancing act between exercise and food and insulin, and sometimes no matter how much planning you do, something goes haywire. You can have a blood sugar that goes too high or goes too low, which is why I'm here today with Dr. Dodell to talk about the Know Before the Low campaign.
And Dr. Dodell, a little bit of your background.
Sure. So I'm an endocrinologist in New York City. I have a private practice. I also do some teaching at Mount Sinai Hospital. And endocrinology, many people don't know what that means when I tell them. So I specialize in diabetes, but also other hormonal things like thyroid and osteoporosis and the pituitary gland and nutrition. So I'm happy to be here and discuss this important topic with you.
Low blood sugar, doctor. What exactly is low blood sugar, and who's at risk for it? Is anyone at risk, or is it something exclusive to someone who's living with diabetes?
Sure. Good question. So low blood sugar is exactly what it sounds like. So there's an optimal amount of sugar that goes through our bloodstream. And low blood sugar, when it occurs, can cause sweatiness and confusion and irritability. And the people that are at risk for it are mostly people with diabetes, so either type 1 or type 2, who take insulin, or oral medications can sometimes also cause low blood sugar. And that's why we're here to talk about this campaign and make sure that people are aware of it and they talk to their healthcare providers and the support network about it to make sure that they're prepared if that were to occur.
Now, Crystal, you experience low blood sugar episodes periodically.
Absolutely. Yeah.
Yeah. So
sometimes
tell us,
it happens.
Yeah. Tell us about that.
Sure. Well, it has happened many times throughout the past 30 years. One time in particular that I remember was while I was on American Idol. Ryan Seacrest is counting down to going live in front of 30 million viewers or something like that, or 300. There were a lot of people watching, and there was nothing I could do in that moment. I had to just push through. And as soon as we went to commercial, I made sure everyone around me knew that I needed some kind of treatment for my low blood sugar, juice, candy, whatnot. And in that moment, the producers on set and my, co-contestants, all of the people around me became my support network. And thankfully, they were able to help me. Now, of course, my support network is my tour manager, my bandmates, and here at home, my 11-year-old son. When I can help myself, that's wonderful. But Know Before the Low is really all about educating people to know what to do in case of a low blood sugar emergency where I'm not able to help myself, which is why I've partnered with Lilly Diabetes. And we just want to make sure that people know what to do. So they can go to knowbeforethelow.com and get more information on how to start these conversations with the people who are ultimately their support network.
You mentioned people around you knowing what to do and being your support group. How do you determine, as someone with diabetes, when it's time to reach out for your support network, or, it's business as usual?
Sure. Well, there have been times when I have been alone, and I have a continuous glucose monitoring system, which can show me trends if my blood sugar is starting to go low. So I can then make sure I have some juice ready or some fruit or something like that. And thankfully, that's the technology that's available now. I just always have to have something with me, glucose tablets or some kind of emergency rescue plan, prescription rescue plan. And, it's just one of the added layers of the struggle of living with type 1 diabetes, but I believe that it has made me stronger
Doctor, when it comes to a low blood sugar emergency, is there a clinical standard for an emergency, or is every situation different for every person? Is that an individual thing?
Good question. So there are prescription remedies available as glucagon, which is a hormone that raises blood sugar in the setting of one of those emergencies. And I just want to distinguish an emergency from a mild to moderate situation where in the emergency, the person's unable to help themselves in that setting. They may be having a seizure. They may be unconscious. And that's what we're talking about. And that's when the support network needs to be available. And that's why it's important to have a prepared plan in place so that those people are ready and able to help if needed.
What about pre-diabetes testing? What does that consist of, and is it something that's accurate, and when and if pursued?
Sure, good question. So pre-diabetes is often picked up on a routine blood test like an annual physical, or maybe there's a family history or other risk factors involved. And people don't generally have symptoms with pre-diabetes. So I think that's not really who this is geared to. This is more geared to people that are on insulin or on oral medications that could cause a low blood sugar. But pre-diabetes is important to be aware of because we can hopefully institute lifestyle changes and other things that can kind of stave off people going on to develop diabetes, whereby they would need medication. That's more for type 2 than type 1.
Mm-hmm. Crystal, where can our listeners get some more information about diabetes, the Know Before the Low campaign, and about you as well, you and Dr. Dodell?
Sure. I would encourage your viewers to go to knowbeforethelow.com, and there they're going to find helpful tips on how to start these conversations with their support network, which could anyone in their immediate community, coaches, educators, family, and have these important conversations so everyone around them is prepared. And people can go to crystalbowersox.com if they want to hear my latest single. But we're here to talk about Know Before the Low.
Thank you so much. Crystal, Dr. Dodell, I appreciate both of you coming on this morning and speaking with us here on Health Professional Radio about the Know Before the Low initiative.
This is great. Thank you for having us.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at 8pr.fm and healthprofessionalradio.com.au.